All right. Hello, everybody. It's Allison Robinson here with Juniper Trails Life, and our business beat this week is with Dr. Danielle Litoff of Battleborn Health. Hi, Danielle. How you doing?
Hi, Allison. I am doing great. Thanks for having me here.
Glad to have you here. Hey, do me a favor. Why don't you just adjust your screen a little bit down so I can see more of you? Would that be?
It's possible. We'll see.
There you go. That's a
Well,
little
yeah.
better.
Let me see what's going to happen if it will stay. If I back up here.
Yeah, that's better.
There we
That's,
go.
yeah.
I'll just stay here.
Excellent. So lots been going on. We're, talking to all of our business partners and just doing a check-in. I know the last few weeks have been real challenging with the shelter in place and creating a new normal. And now people are able to get out and about a little bit more. I've been out in Reno the past couple days, and certainly there's more traffic now, which is great. But what have you been doing to keeping sane and keeping your clients, focused and on track with their health?
I think it's a great question. I think that in all honesty, we all have to be super aware that no one is feeling great every day. Everyone has their good days and their bad days with this. And there are days that we are more motivated to do wonderful things for ourselves than we are for other days. And I think that everyone needs to give themselves a little bit of grace with that, right? And look at the bigger collective with that. I think with my clients, it's showing them how they can be in control of what makes them feel better. And same for myself. I think what's keeping me going is knowing the things that I can do to make myself feel good. And for me, that's, reading a book, it's cooking, it's working out, it's spending quality time, not just quantity time with my kids and my husband, and giving ourselves grace on those things. Picking the things that make us feel good in the long run, I think is super, super important for us right now. And it's reaching out to people that we know and we love and we trust, that can help us out in those times. Having a support group right now is so important. And I feel really fortunate with most of my clients that I get to be part of that. And that brings me joy. So that's part of all of it.
So Battleborn Health, mainly you're, a physical therapist, but you've created this whole health program, this Fuel to Rise program. So tell us more about that.
So my original degree, I have a doctorate in physical therapy, and I've been practicing physical therapy for 25 years. But in the last 10 years, I've had my own health issues, and I have gone back and gotten certified in what's called functional medicine. And functional medicine is the integrations of systems within the body. So with functional medicine, we don't just look at one or two symptoms and say, oh, you're depressed, here's some antidepressants. We look at all sorts of what seemingly can be unrelated symptoms, bloating, gas, anxiety and depression, or sometimes what we call accident husband's head syndrome, where you have no patience for anybody anymore, where you have unrelenting cravings for carbohydrates, or where you can't sleep anymore. All of those symptoms, they seem unrelated, but when you're looking at functional medicine, they are all related. And they're related to how we look at overall health. And as a physical therapist for 25 years, I had great results with my orthopedic clinics, but our patients. But over time, I would see some people that wouldn't get better. And a lot of times they wouldn't get better because they have chronic inflammation, or they have these other symptoms that stop them from doing what they love. So I've created two programs. I've created the Fuel to Rise Reset, which is an 8-week program. And that's for people who right now are feeling a lot of these, like they were doing fine, they were working out and they were eating well, and they, overall felt fine. But in the last 2 months or so, they've really felt some of these symptoms creeping up. And these are symptoms that people sometimes associate with age, like fatigue, or like I said, gastrointestinal issues, even more acne or skin issues, or more sensitivity to foods. Those types of things, if they've just creeped up in the last 8 weeks and you just need help kind of crawling out of the hole, the 8-week program is awesome. I have a second program, which is the 16-week program, and that's more of a deep dive. So for people who are struggling with some of those things, weight gain around the middle, no matter how much they worked out, chronic injuries or chronic sinus infections, things like that, where they couldn't understand why these things kept happening, that we can go into a deeper dive and look at the lifestyle factors that are really associated with cleaning that stuff up so that you can get back into that high level of activity and high level of health that we all want to have.
So you really, I know in your practice, you really try to integrate a lot of different modalities into sort of this total health program, which I think is really terrific. So, in addition to this Fuel to Rise program that you have, what other services, do you offer at Battleborn Health?
So Battleborn Health, we look at the whole body. And because, you can't really have a shoulder without a spine, without a heart, without a liver, without a brain, right? So we try to integrate all of those things. So really what we love to do is we like to take people who really want to be shoulder injury, we help them get back to their activities. If they've got a back injury, we help them get back to their activities, knees. So your general orthopedic clinic, but we're looking at how everything integrates. We can't just look at one piece. The way that we practice here is Dr. Sarah Martinez and I, our physical therapists here, we're working with people one-on-one, which I think right now can give people a little bit of peace knowing that they're gonna come in the clinic and it is going to be the doctor and them. That is it. So you have this whole practice, you have this whole space where you can be safe. And you can really be focused on. We are here for you to get you back to doing the things you love so that you can really truly become stronger and know how to work better so that you can be stronger than yesterday, no matter what's come up.
Excellent. And before we go, one last thing, as I know that you work with athletes, especially teenage athletes and kid athletes, etc. So I know a lot of our viewers have young, have children in their teenage years and that are super active and involved in sports. So why don't you just briefly, let our reviewers know about how you can really address some of those issues that a lot of teenage athletes get.
So in normal times, I feel like teenagers are overtrained, right? And, coaches, they're usually either sports specific or they're jumping from sport to sport to sport. And as the kids are growing, they can tend to get very common overuse injuries. And coaches, they may or may not understand that, and they may or may not understand how to rehab that. I was a youth athlete throughout. I was a college athlete, I was a high school athlete, and that's actually what got me into physical therapy in the first place. So what I love to do is work with the parents and the kid and find out really the root cause of why they're hurting, retrain them, and then show them what they can do to supplement for their sport. So that as they're growing, they don't injure those things again. They can heal them, they can injure them. They can heal them and not re-injure them. I think a big thing now that we're going to see as kids go back into sport, I think we're going to go in too far too fast. And I think that's going to be a really big thing. I think parents really need to be on the lookout on, if your kid has not been training, if they jump back in 7 days a week, really hardcore activities, although that's going to be fun for them, in the long run, that's going to create a strained situation. So that might be a tendonitis, it might be a shin splint, it might be something like that, or a recurring hamstring. Bringing them into Battleborn Health, we can get them into a program where they can heal that, and then they have their own home program, somewhat of a cross training for them that is established just for them so that they can get back into their sport without having those subsequent injuries that happen so frequently in kids sports. And, like I said, I was an athlete growing up, which is what got me into PT in the first place, but I've also been a coach for my children and been involved in youth sports in so many different dimensions. So I've seen it from every different way. And I love working with parents, I love working with kids, and I love working with coaches to make sure that those athletes can get what they want.
Excellent. All right. Well, hey, thank you for taking the time to talk with Juniper Trails Life today and let us all learn a little bit more about your business and everything you have to offer. I think your Fuel to Rise program is just really what we all need right now. And then, again, just the special sort of gift you have with working with youth athletes. I think that's another dynamic that is real important for for people to know that you're a great resource, you know, in a lot of different areas. So Danielle Dr. Danielle Litoff can be seen every month in our monthly publication. She writes a column that keeps everybody healthy. And if you have any more questions or like to talk to Dr. Danielle directly, you can certainly give her a call or reach her at Battleborn Health. So thanks again, Danielle, and we will catch up with you soon.
Thank you so much, Allison. It was great hanging out with you and really appreciate the time to talk to your viewers.
Of course. All right. Have a good day.
You too. Bye-bye.
Bye.